Good morning everyone, I'm James Gatan Sabado from the Bachelor of Science in Radiologic Technology Level 2 Section B, and today we're going to discuss about the pectoral girdle. Okay, so pectoral girdle is under the appendicular skeleton, which consists of the bones of the upper and lower limbs, as well as the girdles which attach the limbs to the axial skeleton. The pectoral girdle is also known as the shoulder girdle, and it consists of 4 bones, 2 scapula, and 2 clavicles. The scapula, or also known as the shoulder blade, is a flat triangular bone with 3 large fossa where muscles extending to the arms are attached. It is commonly called the wings of human. So if you are wondering if how does a scapula look like, then you can see here at the photo, makikita nyo po yung nalook dyan. Yan po, yung parang flat, triangular flat bone po dyan na parang pakpak. Yan po yung tinatawag nating scapula. Ayan. So, to study it more further, then here is the more clearer view of the scapula. So we have the right scapula here, which is the anterior aspect, and we do also have the right scapula here, posterior aspect. We also do have our right scapula in lateral aspect. So in right scapula or anterior aspect, nakikita po natin yung mga parts dito. So, the scapula has 2 important processes. Number 1 is the acromion, and number 2 is the coracoid process. So, acromion, nakikita nyo naman po ito. Yan. Ito po, yung may bony projections. Okay, so acromion, the enlarged roughened end of the spine of the scapula. So nakikita nyo po yung spine dyan, pahaba po siya, and as always nakikita po yung spine sa may likod, and sa taas niya po nakikita po natin yung tinatawag nating acromion, the enlarged roughened end of the spine of the scapula. Then next we have the coracoid process. The beak-like bony projection, corac means raven or crow. Then it points anteriorly over the tip of the shoulder joint and serve as an attachment point for some of the limb muscle. Okay, so other parts, we can see the glenoid cavity. So it bulge in. Yung nakikita nyo po dyan na nag-bulge in, yan po yung glenoid cavity. Bakit nga ba nag-bulge in siya? Because the function of the glenoid cavity is to receive the humeral head. Okay. So, next we do have the clavicle, or also known as the collarbone. Clavicle or collarbone articulates with the scapula at the acromion process. The proximal end of the clavicle is attached to the sternum, providing the only bony attachment of the scapula to the remainder of the skeleton. So as you can see at the picture, here is a more clearer picture of the clavicle. Meron po siyang lateral acromial end, and we also do have the sternal end at the superior view. So, makikita naman po natin sa inferior view, nakikita yung acromial end and then yung sternal end. Ayan. So if you are wondering if how does this pectoral girdle are being attached, then makikita po natin dito sa picture na to. As you can see, there is this sternum. So actually, that point of attachment is the manubrium. Sa baba niya, yun yung sternum. Then yung parang sword niya, yun parang yung xiphoid process. Then yung notch sa taas ng sternum is what we call the jugular notch. Then nakikita yung clavicles dyan. yung clavicles is the only attachment to the axial skeleton. So yung clavicle po natin dyan, naka-attach po siya sa sternum, at yung tawag po sa joint na nagko-connect sa bone na yon is sternoclavicular joint. Then nakikita din po yung scapula dyan. Okay, so did you know the clavicle is the first bone to begin ossification in the fetus? Ayan. So, alam nyo ba na yung clavicle is yun yung unang bone, yun yung pinakaunang bone na magpo-form kapag fetus pa lang. Ayan. So, the clavicle is thicker in adults and is less vulnerable to fracture. The next we have, even though it is the first bone to begin ossification, it is the last to complete ossification. So, very well explained naman doon na siya po yung nauunang mag-form, but then siya pa rin yung nahuhuli sa pag-form. Siya yung nahuhuli na mag-form. Okay? Next, imagine yourself without a clavicle. So, there is a photo here that a boy who is suffering from cleidocranial dysostosis, a birth defect that mostly affects the bone and teeth. The collarbone are typically either poorly developed or absent, which allows the shoulders to be brought close together. So, napakahirap siguro no na kapag hindi fully develop yung collarbone mo or yung clavicles mo. Parang ganyan yung itsura mo. Ayan. So, if you are wondering if how can you locate that pectoral girdle parts, which is the clavicle in outer side of, aside from the skeletal system, then Miss Nadine Lustre is giving you the best example. So Miss Nadine Lustre is the sexiest woman in the Philippines year 2017 and year 2020. So nakikita naman po natin yung bony projection sa baba ng kanyang leeg. Ayan, so nakikita po natin yung clavicles niya. So the clavicles or collarbone as a standard qualification of being sexy. So yung collarbone po daw is nagiging standard qualification na siya ng pagiging sexy. Now I command you to take a look at yourself in front of a mirror. Then if there is a body projections of your collarbone or your clavicles, then I think you are sexy. But if not, hindi po siya prominent, then you are sexy in your own way naman. So, thank you for listening, and Padayon Future RIP.